In January this year, an 8-year-old girl committed suicide in Omoro district. Rebecca Abe, who was in primary 2, reportedly killed herself after her guardian scolded her from dirtying herself as she played with her peers. This is just one of the many cases of suicide that have been reported in Omoro over the years. Isaac Ogwal, a clinical psychologist at the African Center for Treatment and Rehabilitation of Torture Victims, says there are a number of reasons for the high rate of suicide cases, especially in Northern Uganda.
But also in the north here, we have had a war going on for so long. And then there are issues of post-traumatic stress disorder. So one of the symptoms of post-traumatic stress disorder is suicidal ideation or thoughts of suicide.
He says some people fail to notice the suicide warning signs from some of the victims, which makes it difficult to quickly offer help.
They think about the society as being unfair. They also think about people around them as being unfair. But also in terms of behavior, they lose interest in pleasurable activities. If someone has something they enjoy so much, with time you're going to see them being withdrawn a bit.
Koro Sub-County in Omoro District has lost 56 people to suicide between 2005 and 2018. Charles Watmon is the LC3 councillor representing older persons.
In the research that we carried out of 56 total number of people who committed suicide, 44 of them were men, young men, and then 12 were women.
Watmon lists some of the prominent cases registered in the recent past.
There was a situation in a Bakara parish where a woman, a pregnant woman, and a baby over 3 years decided just to throw themselves in a pond, and all of them died. There have also been cases, remember a young man, a boy, he just committed suicide because the grandmother refused him to sell a puppy.
Benjamin Spatos, an artist, suffered a mental health condition 3 years ago. He now plays music and entertains patients at the mental health clinic in Gulu Regional Referral Hospital. Since there was nobody available to give him any kind of support, Benjamin says composing songs about his condition gave him some comfort.
Mainly it was the music the compositions that I wrote helped me better understand my condition, myself, my feelings, other than hiding them and burying them away.
Benjamin says most of the patients still encounter problems when they are discharged, and in most cases, the suicidal thoughts return.
You're sent back to your community when you're a bit better, but then your community is pointing fingers at you. They're still beating you up like you're an animal. They're treating you like, you're not a human being. That affects your recovery. So any kind of medication you're getting is not literally going to work because they're not giving it ample room to literally help your body or your brain to function well.
The need for mental health services in the region is high.
If there could be maybe a center somewhere where if somebody is so disturbed like that, could be brought to and given counsel.
And there are so many mental illnesses that our community does not know about.
According to a recent report by the World Health Organization, about 800,000 people die of suicide every year. Nelson Omoya, NTV.